For those who have not attended one of these sessions before, welcome, and for those who have, welcome back. My name is Jenna. I'm a member of the TDS Health Customer Engagement Team. So if you are a current client, you've probably seen my face with regards to training of content you have, as well as maybe onboarding new resources. That's usually when you work with myself. And so we also work with the rest of our team to host some sessions about different product offerings we have, specialty disciplines, things like that. So today I'm lucky to have my colleague and friend Preston on with me from our sales team, who's going to be supporting me through our presentation. Preston, I'll let you do a little brief intro of yourself.
Yeah, thanks, Jenna. So I'm Preston Ramey. I'm based here in Ohio, Southern Ohio, and I cover a couple states in my territory from Ohio, Tennessee, Indiana, West Virginia, and some eastern parts of Canada. So if you're a customer of mine, we might have met before. If not, you're a new face. I'm, looking forward to working with you, hopefully. And yeah, thanks for joining.
Thanks, Preston. So Preston's going to monitor our chat and things like that. So if you have questions throughout or anything, you're welcome to pop those in there. He'll keep an eye out for those for me. That way, if we have questions or things that come up, we can address those as we move through. So for those who have not attended one of these sessions before, just to give you a little bit of an idea of how these usually work. We like to host these sessions, like I said previously, either by specialty, by product, to give you an idea of certain types of content for maybe a particular group or a particular interest that you have for whether that's your students, your faculty, or maybe a mix of both. So today we'll be focusing on some of our content offerings specifically for those within an undergraduate nursing program. I like to call out at the top of these webinars that if you have landed in here by accident, or maybe this isn't a specialty or discipline that you're focused on primarily, the likelihood of us having content that applies to you is very strong. So we'll be focusing on our undergraduate nursing content today and some of the materials we have, but I do want to call out that if you have a graduate nursing program, we do have content for NP programs, and then also if you are a practicing nurse and looking more for certification and things like that, we do have content offerings in those areas as well. So just in case you've maybe landed in here and this isn't as applicable to you, feel free to stick around, but we do have content offerings in some other areas, specialties of nursing as well. These sessions usually go pretty quick because we try to limit to half an hour. I'm notorious for going a couple minutes over, so please feel free to hop out if you have something else. We will record this session and distribute it to all registrants and attendees, so that way if you want to review it, refer back, or pass it on to someone else, you'll have the ability to. So I'm gonna hop over to my quick little topics on my little 2-page presentation to kind of give you an idea of what we're gonna cover. Like I said, we'll be focusing on content for undergraduate nursing specifically. So we are going to look at 2 content products specifically today. One of them is going to be Ditki, and the other one is going to be called Primal Pictures. You may also know it as Anatomy TV. Those are the 2 content pieces we're going to look at today specifically. I want to also call out that we have some question bank style tools as well as ebooks for undergraduate nursing in the TDS Health umbrella as well. So if those are things of interest to you, we do have those as well. Today, we're going to focus on these 2, a little bit more of interactive platforms versus kind of a singular use tool. That way we can show the various different ways that they've been able to be utilized for undergraduate nursing programs. So we'll take a look at both of those products. We'll pop into them briefly and look around, and then also we'll talk about some examples of how we've seen programs utilize this. Like I said, I do a lot of the training and onboarding of content. So once Preston and his team work with a client to purchase material, whether it's adding on to existing content or if it's a brand new subscription through us, they then get sent over to me to where I can work with you all on training and kind of product demonstrations, getting you in there to really make sure we're maximizing how to use something. And so I've seen a couple of examples in different situations in where people have gotten really creative with using these products. And then we'll have a little bit of time, hopefully, for Q&A. But again, please feel free to pop those in the chat as we go if there's anything that comes up as we move through. So we're going to go ahead and start with Ditki. If you have never heard of Ditki before, it was previously known as Draw to Know It. Founder and creator is Dr. Adam Fish. He's a neurologist. And so I'm going to pop over my screen to my Ditki account. So I'll call out briefly that Ditki, if you are a current subscriber, your courses page might look a little different than mine. I have access to all the Ditki content, so mine's going to have a pretty robust offering level. But if you are also a member of a library team in here today, where you would maybe supporting different facets of a health sciences program or different health sciences schools, medical schools, things like that, this is a good way to kind of show you that we have a variety of different courses within the Ditki collection. Today specifically, I'm going to focus over here on the right-hand side on the anatomy and physiology fundamentals for nursing, and then also the pathophysiology for nursing, which are over on the right-hand side. But you'll see that there's a variety of other pieces in here as well. Quick elevator pitch on Ditki. So Dr. Fish is, like I said, he is a neurologist, and so when he and his team worked on creating Ditki, they wanted to focus on having content offerings for every different type of learner. So whether you're someone who's an auditory learner, a visual learner, a kinetic learner, someone who likes to do more quizzing and flashcard styles, something in here for you. That way you're not having to go and seek out different materials in different places. It was a way to put all those comprehensively into one spot. So within Ditki, like I said, there's a variety of different content offerings. Today, we're going to focus on the two that I pointed out of anatomy and physiology for nursing, and then pathophysiology for nursing. I'm going to open up the pathophysiology section just to kind of show you how this layout looks. So within Ditki, like I said, you'll have a variety of different types of content available within a certain topic area or specialty. So in here, you'll see that we have almost like chapters of the different sections that we have in here of different content materials. So you have the ability to move through these, and then within there, you'll have subcategories that you can take a look at. So if we look at cardiovascular, you'll have a couple of different options in here of material you can look at. I do want to call out that there is some NCLEX content in here, so there are some questions specifically for NCLEX preparation within Ditki. So if that's something that's of interest to you, that is something that's in here. And then with each of these tutorials, it'll have a corresponding video that you can take a look at and review. There's also flashcard offerings that are in here as well. We found that these are incredibly popular amongst programs because they have a really nice cohesive way to look at different content, have it broken up into a short little flashcard for your review. But I'm going to quickly open up one of the tutorials just to show you how this looks. And I'm going to mute
Here we'll learn
Dr. Fish so I can talk over him a little bit. So what I like to point out with the tutorials is that they are intentionally built out to show everything on the screen. So you'll see that we're starting by building a column over on the left. We're talking about heart failure. And as I click through the video kind of speedily through, you'll see that that builds out over time, and we're adding on to that material as we move through the tutorial. And this design is intentional because what Dr. Fish was finding is that students, when they're going to look at video content or material online, they're either seeing things so quickly that they don't have the time to digest it. Things are popping on and off the screen, so they're not actually digesting the material they're seeing, or the content offering is too long and they're losing interest and not actually staying on to maintain and watch the entire thing. And so that's kind of where the inspiration for the tutorial layouts are. So you'll see that these move out and they fill up over time to where at the end of our tutorial, we'll have a complete cohesive kind of image, whether that's, tables, structures, kind of pathways. You'll have that built out at the end of the tutorial and comprehensively on the screen. Alongside the tutorial, you have a note section over here, which is going to have note content that relates to the tutorial you're seeing. You also have the transcripts that you can pull out. So you'll have details over here on the right. And then we have a couple of other materials that we can utilize for each tutorial. There is a quiz offering, which will have quiz questions that you can move through of the tutorial you looked at, as well as a drawing pad where you can take the imagery that we were seeing in the video and you can apply that in a drawing space. So if that's something that you have, like a kinesthetic learner, or if something you'd like to incorporate, you can do that by having certain imagery pieces placed in here for your students to complete on their own to be able to draw out the rest of a tutorial. Preston, do you have anything you want to add right now?
Oh yeah, I just wanted to kind of call out and emphasize that the tutorials, as you notice, most of them are in digestible chunks, so they're anywhere from 5 to 10 minutes long. So very, short videos, so students can you can kind of capture their attention. So I've seen it used a lot in a flipped classroom approach, where you assign maybe 1 or 2 tutorials before lecture, so students can watch the videos, maybe do some of these elements like the drawing pad, take a couple quiz questions, and then come to class more prepared than if they were just learning the material for the first time. So we don't have any comments or questions yet, so I'm keeping an eye on that as well, Jenna.
Perfect. Well, that's a good call out, Preston. So we do see this utilized a lot in that way, where content from the Ditki platform is utilized in preparation prior to a class or a course, or maybe even refresher content. Like we looked at when we first hopped into Ditki, we have anatomy and physiology fundamentals for nursing. And so a lot of people, that's a prerequisite course. We'll talk about that a little bit more within the Primal Pictures platform, but it's a good way to have students go back and review and refresh on certain material that maybe isn't as front of brain as it used to be. Also within the drawing pad, you can choose the level of the drawing that you want to do. So you can start with a completely blank canvas, try to draw something out completely from memory, a starter canvas where some of those key starter points are, or you're even able to label at the end of the video. So you can really break this out into chunks of how, where the student is at, and also how much of the actual drawing component you want them to be utilizing.
I also wanted to add to that
Sure.
those starter images, sorry, Jenna, that you can even download those to your device and incorporate them into a lecture, or even, to assign them to students on a printed out handout. So I just wanted to make that call out as well too, that some of this is downloadable as well.
Yeah, that's a great point, Preston. Let's go ahead and use that to talk about some of the administrative features that we have in here. So one piece is that a lot of the content is downloadable, that you can take this out, apply it into your own presentations, your own content. You also have the ability to look at student interactivity in here, look at how much they're going in, answering questions, and doing things like that. So if you wanted to turn over to students to say, hey, go into this particular course section, do the tutorial, do the drawings, you're able to use the administrative features to look at that interaction and to see what they're doing, as well as taking material out to build out maybe your own lectures or your own content that you want to take from here and use. Um, you'll notice in here that we also have the questions and the question keys. So Ditki does have some degree of embedding in integration with LMS systems. So Canvas, Blackboard, where you can maybe embed a tutorial or things like that, but we can't actually embed questions for grade, kickback, or pushback in there. So if that's something you want to get those scores, we do allow those to be downloaded out in a CSV file. So then you can put them into your LMS system if you want to assign that way. So really we make it so you can take out the material you would like to utilize and use it in the way that makes most sense for your course. And then the last little bit that I want to talk about, just kind of about the overall administrative features side, is going to be the options of creating both study plans and then custom courses. And so study plans are your ability to take a particular course and pull out individual content that you would like to utilize for a study plan. So for example, we're on this pathophysiology for nursing, and let's say that as a faculty member, you want to pull a couple of pieces from cardiovascular, endocrine, and gastrointestinal. There's this little study plan option over here on the right where you can create a study plan and you can pull out individual tutorial materials to build a custom plan for your students within a particular course. So let's say that you don't intend to use everything in here and you want to focus on a couple areas. Again, maybe it's a refresher course or maybe something you want them to complete prior to moving into a certain rotation or section. You can build out a study plan specifically with material that you want them to focus on. And then the other option, which both Preston and I have seen utilized a lot across Ditki users, is the ability to do curriculum mapping and custom course creation. So if you're a current subscriber of Ditki, whether it's a singular course or multiple courses, this option is available to you. It's not an extra charge. So if it's something that you haven't been able to explore, or if you're in the library and your faculty haven't explored it, or you haven't been aware you can do this, Ditki allows to work with faculty on building custom courses. And what we mean by that is, let's say you have access to a bunch of courses within Ditki. So it looks like my home screen where you have a couple of different areas and you want to see what is in here to be able to create a course for a particular course you're offering. Maybe you want to go into some of the anatomy and physiology and the pathophysiology, or maybe you're doing more of like a systems approach and you want to do something on the neurological system. So completely dependent on what you're wanting to deliver and the content of Ditki you have, they will work with your faculty to build out a custom course. I have a couple examples on my screen over here under institutional. These are some of the programs that we've worked with on creating custom courses. This top one is actually a nurse practitioner program based here in Arizona, but they wanted to utilize the content within their Ditki subscription to build out a pathophysiology course. So you'll notice that it's designed specifically for what they wanted to utilize, and it's built out into different sections. So this was with the Ditki team. They worked with them to build out a custom course for them that they can then invite their students to, and they'll see this exact custom course and can do all the modules that they're expected to complete. That is the main rundown of Ditki as a whole. And like I said, there's a variety of different types of content in here. We hopped into the pathophysiology. I will quickly open up the anatomy and physiology fundamentals for nursing just to show you the different sections. You'll see it's broken out by system. And so those are the two, kind of more obvious Ditki courses that we see utilized within undergraduate nursing program. But I have seen people pop into some of the pharmacology pieces of that and adding those in as other alternative elements into their teaching area. So that is something I like to point out there, but that's kind of the main rundown of the Ditki platform, the material, and then also the functions that you have utilizing the tool itself. Preston, anything you want to add before I move over to Anatomy TV?
Oh, no, I think you've done a great job. I think the only other thing I would add is that the great thing about pretty much all of our tools, the way subscriptions work is that they're a la carte. So even if you just wanted to get started with one tutorial or one course, I'm sorry, you could do so, and then eventually work your way up to adding more once you get more comfortable with it, or just stick with one or two. Just depending upon your needs. So I just wanted to point that out, that you don't have to have access to everything. You can just simply purchase as little as one or two modules and then go from there. So
Awesome. Thanks, Preston. Yeah, so we really make it easy to build out material that complements your program. So not feeling like you have to have everything, but if you want to, you can. And then you have those additional features to be able to do, the custom curriculum mapping and all of that to pull out the material that works best for you. If you're a Ditki subscriber, whether it's a singular course or multiple courses, and you are looking at it going, maybe there's something in there for me, there probably is, just because the Ditki platform is so comprehensive. So even if you're not sure that the material you have, if it aligns with the course you're offering, feel free to reach out to us to look at that curriculum mapping, because there could be at least one or two tutorials to get you started in there. You find your students really like it, and then you can look into expanding if it's something you're interested in. So we're going to switch gears over to our second product we're going to be talking about today, which is going to be Anatomy TV powered by Primal Pictures. So I just switched my screen over. Similar to Ditki, I'll give a little elevator pitch. You may be familiar with the name Primal Pictures, you may be familiar with the name of Anatomy TV, or maybe both. So the official name is Anatomy TV powered by Primal Pictures. So Primal Pictures is a company based out of the United Kingdom, predominantly anatomical content that we're going to look at today, but there's a lot more in here than just anatomy. And then just a standard understanding of what it is to take anatomy and physiology courses. I could tell you all the different things that they pride themselves on about how they develop their content, but the one they really lean into is the accuracy component. All the models and material we'll be looking at in here is built off of real scan data versus artistically rendered. And so they really lean into how that allows them to give really medically accurate content. So if you're looking at these models, you're looking at this material, you can feel confident when you move into the actual clinical space. So I'm going to hop over on my screen to my module dashboard within Anatomy TV. Similar to Ditki, I have access to all the content. And so some of this material may not be completely applicable to your group. Others it may be. And then if you are, like I said, a library landing in here similarly to Ditki, you'll see that there's a lot of different content offerings. So if you're helping out different medical specialties, program levels, things like that, there's most likely content in here that is useful for you. The one I like to lean into first is going to be the anatomy and physiology content in here. Similarly that we talked about with Ditki, a lot of these foundational concepts, we've worked with clients who have found that when they have A&P as a prerequisite, or maybe as that early first year course where this is introduced, by the time that they're moving into where you're adding on the clinical component to the anatomy and physiology, some of those key foundational concepts have kind of gone out the window for students. It's either been a really long time since they've looked at it, or you can't necessarily always control the environment a prerequisite course is delivered in to where how involved a student may or may not have been. So we've seen this especially utilized as a way to refresh material to students and then also add on kind of that clinical application that they'll be seeing when they move into the nursing field, where they're actually seeing the presentation of diseases, conditions, circumstances, of where they'll see these anatomical and physiological concepts like at play. So this probably looks familiar to you if you ever taken an anatomy and physiology course. It's lined out very much like the sections of an anatomy and physiology textbook. But one piece that I also really like to point out is how you get some of these very unique views that are really difficult to conceptualize when just looking at a textbook. So for example's sake, I like to pop into histology. For me, when I was in my undergraduate programs and I was first getting into my health sciences, understanding some of these micro anatomy elements, what they really looked like, how those structures appeared, that was very hard for me to conceptualize just looking at a 2D textbook. And so a lot of this content in here can be utilized as a great, like we said, not only as a refresher, but also maybe to give you some of these conceptualized views of things that you weren't necessarily able to digest when you were looking in just like a 2D environment. Within the anatomy and physiology module, within Anatomy TV, you have these interactive models. And like I said, it's kind of like an interactive textbook where you've got some interactive learning pieces like quizzes or point and click activities. And so really it can be a great way to have students refresh on certain material. If you wanted them, for example, we're in the connective tissue, you want them to refresh themselves on this, go through, read this section, complete some of these interactive learning pieces, answer a couple quiz questions. It's a really good way to get them back into the thinking and back into those foundational concepts that maybe have gone out the window after not looking at it for some time. And then we add in a clinical component to this. So after doing those kind of refreshers, we have these clinical correlates in here. And so that can be anything from different clinical conditions that present in here that you can look at these clinical correlate review pieces. So taking that section we just looked at and then applying the clinical component to it. We also have aging, and so having the application of how age affects that system, and so seeing that how that will present when you see patients. And then lastly, case studies. And these are some case study examples of certain types of conditions, things that you'll see that are presented with injury, where you can look through, review, and reveal answers of those case studies. So again, taking those foundational A and P concepts and then letting it be a refresher or maybe an introduction, and then applying the clinical component, which will then very much relate to what they'll be seeing when they're in practice. Preston, anything you want to add there?
Yeah, just I guess one common question I get is how can I make this material kind of specific to me and save it to my device or save um, frequently access or images that you want to see over and over again without filtering through it. So if you notice on the left, there's a little star icon, and that's the ability to kind of create personal profiles. So you as a student, a faculty member, a librarian can actually save that material specific to your device. So that way, if you come up with a viewpoint or an image that you like and you plan on using over again in courses or studying, it can be saved directly to your device, and it's easy to access again when you relog in, the next day or a week later. So that's just one call out I wanted to make.
Yeah, that's a great point, Preston. So the personal profiles, to Preston's point, is a really great way to create a set of content that you're referring to quite a bit. So whether that's you are a faculty member creating out lectures or a student, you're referring to material a lot, you can build out those personal profiles to make that accessible and easy to get to. One of the reasons personal profiles works really great is, for the most part, Anatomy TV is device specific. So if you're on your laptop at home and then you go in and you're on like a lab laptop, the content that maybe you saved just in a regular favorite style folder isn't going to transfer. So that personal profile allows you to be on any device and move around, especially for faculty who might be moving through different classrooms or different devices. Um, this also becomes really useful if you have access to a lot of Anatomy TV content. So some people on the call may be current subscribers. Maybe you have this full, complete access to everything within Anatomy TV, and you want to focus on certain areas or have your students focus on certain areas so their dashboard isn't so overwhelming. And so that allows you to pick and choose what you want to see, what you want to access quickly. That way it's a little bit more digestible for the students who are moving in here and looking at content. In that same realm of thinking, there are some other sharing and user tools in here that can be utilized by faculty and students when interacting with Anatomy TV content. So we were in the little star icon, which is the favorites, but you'll notice underneath it, there's this little three dots, this cloud, and then this little arrow going into a box. And those are other sharing tools where you can use a copy link tool to send links back and forth, whether student to student, faculty to student, student to faculty, of particular places within Anatomy TV that you are. So let's say you want all your students to go to this particular view with this highlighted, you can use the copy link tool to send them there directly. You also can embed a lot of this content directly into your LMS system. So let's say this view that we're looking at here, we wanted to put that directly into Blackboard for your students to interact with it. So that's where the embeddable viewer piece can come in. And then lastly, if you wanted to take material out like a still image to label, draw on, to download into Paint or something and make a lab practical, you can take things out in still images. So a couple of interactive features that you have within here of how you can use the content and deliver it depending on what your preference is. I know we're running up right to the end of the half hour, which is usually how it goes. I do want to call out a couple of places where I'm not going to be able to go in to them directly within Anatomy TV, but some other areas that I see of interest within the undergraduate nursing space is going to be the diseases and conditions section. This is going to be specifically the pathological implications with how that affects the anatomy. So looking at injuries, looking at actual conditions, and how that actually affects the anatomy itself. So just quickly, I'll pull it up. You'll see that we have different specialties. Cardiology, you'll see, angina, aneurysm. So these are all kind of different introductory areas, as well as review of how this actual injury affects the anatomy itself and how that then presents. So something that very much can relate within a clinical component when you are getting into rotations and looking at those things in space. And then there's a variety of other areas in here that are useful for different program styles, whether it's virtual dissection content or imaging. There's a lot of material in here. So that is going to conclude the presentation for today. I know we're right at the end of the hour. I didn't see any questions coming through. Preston, was there anything that popped up for now?
No, no comments or questions for now, but feel free if there are any questions, let us know, or we'll definitely, be reaching out with the recording. And if you do have questions or would like to set up a more one-on-one demo, we can have a rep for sure reach out and get that scheduled.
Awesome. Thanks, Preston. One other thing I want to call out quickly is that both of these tools have a mobile interface. So whether there's different apps or different mobile applications, both of these can be used in a mobile environment, which I know is very useful with students now moving toward tablets versus desktops or moving on phones. So those are things that are there. And as Preston called out, we are more than happy to set up additional sessions with you. These are really meant to be introductions to content. So to give you an idea of what we have within certain areas and certain fields that may be of interest to you. If you want to explore one or multiple of these products, at length in an additional session, we can set something up. And then if you're a current client, and you're looking at these and you have access to these and you're like, wow, that would be really great to do a presentation for our students or within our library. We are more than happy to host those as well. Don't feel like you have to take those on. Customer engagement, which is the group that I'm in, that is our focus, is giving you the material that you need to promote content to students, so promote what you already have. So we're here to support with that if that's something you're interested in. Like Preston said, we will send out a recording and some details. So if there are additional questions that come up, feel free to follow up with that. And then if there's anything else that you all need, please don't hesitate to reach out. We appreciate you taking the time to hop on these sessions and let us talk at you for about half an hour. We'll be continuing these in the new year. So if you have not had a chance to attend some of these and want to start hopping into them, keep an eye out for those next year. We do also have a page on our website which has upcoming events. So you're welcome to look there as well to see what we have on the agenda.
Yeah, thanks to everyone for joining today. And like we said, we'll be in touch with the recording. And if any questions come up, we're happy to help.
Thanks, everyone. Have a good one.
Thanks.
Bye.